video, a 26-year-old woman is hospitalized with kidney failure after going to the hair salon. And also, the kidney of a 20-year-old explodes after going to the gym. And also, a 71-year-old man needs a transplant after eating a single plant-based food. Gathering here, it's recent news that a previously healthy 26-year-old woman suffered from 3 different cases of acute kidney injury between June 2020 and July 2022. She was hospitalized each time with severe fever and pain, and the doctors found inexplicable calcium oxalate formations inside her kidneys. The damage to her kidneys was severe. But how is this even possible? We will find out in a moment. Because what's even more remarkable is that this is not even the most incredible story that we will see today. In fact, there are 4 even more incredible hidden dangers out there that costed people their kidney health and that you will want to know about. So let's start immediately and let's see what happened to the 26-year-old woman that suffered 3 acute kidney injuries after going to the hair salon. As I was saying, this made the headlines recently. So this is all about a Tunisian woman with very curly hair, but she wanted her hair to be straight, so she went to the hair salon and asked for a Brazilian-style hair straightening procedure. At her hair salon, they were sure everything was safe. In fact, and this is important by the way, they were using formaldehyde-free products to straighten her hair. Why is this important, you may ask? Because these products are widely used today and they are still not banned even after this and other similar episodes. In fact, the 26-year-old Tunisian woman is not the only one who has been reported to suffer from acute kidney injury after this kind of procedure. After 2019, there have been other 26 cases of women hospitalized with acute kidney injury after using hair straightening products. Some of the women eventually had to undergo renal replacement therapy. This happened because most people recover enough of their kidney function after an acute kidney injury, but not everyone. So question, what hair straightening products were they using and why no one is doing anything about this? As I was saying, in most countries today, formaldehyde-free hair straightening products are mostly used. Formaldehyde has been banned because it is toxic. But what they replaced it with is probably just as dangerous. All the women who suffered acute kidney injury were treated with products containing a chemical called glyoxylyl carbocysteine. So, if you have curly hair and if you decide to get them straight, never use anything containing this chemical unless you want to risk acute kidney injury. And while, as I was saying, not all the cases of acute kidney injury following the use of hair straightening products ended well, the 26-year-old woman from the news was able to recover enough of her kidney function to keep living a normal life. I hope with curly hair as well. Now guys, today's video is not made only for entertainment. As I was saying, this is not the only case of people losing their kidneys in circumstances that could have been avoided. It's important that people know about this and that they are warned. This is why you should consider giving this video a like and maybe also sharing it with a friend. Up next, let's talk about the hidden risk of going too hard in the gym. Now this happened in 2021 and it's even more incredible than what happened to the 26-year-old with curly hair. This is about a young man, just 20 years of age, whose kidney actually exploded while training in the gym. How is this even possible, you may ask? After a weight training session, the man presented to the emergency room with sudden onset abdominal pain. He reported a feeling of bursting and severe pain in the abdomen during weight training. His kidneys exploded, literally. In fact, what the doctors found inside his body shocked them. As we can see from the CT scan they performed, only the left kidney of the man was visible. But where was his right kidney gone? Well, it was still there actually, just not in one piece anymore. There was nothing they could do about his right kidney apart from removing it from his body, as well as 700 cc of hematoma. But how is this possible? And how can you prevent your kidneys from exploding the next time you go to the gym? Well, what most people do while they lift heavy weights is something called a Valsalva maneuver. This is a breathing technique that increases pressure in the chest in order to protect the spine. And this sudden increase in pressure is exactly what caused the 20-year-old man's kidney to explode. What this man didn't know is that one of his kidneys was atrophic and hydronephrotic. What this means is that one of his kidneys was too small and somehow blocked and full of fluid. When the pressure inside the body of the man increased violently during his gym session, this caused the kidney to explode. So this man lost a kidney, but luckily for him, he was discharged just 3 days after the accident with no more abdominal pain and normal kidney function thanks to his remaining kidney. Now, what happened to this man is not common, luckily, but you should still make sure you are not exercising too strenuously if your goal is your kidney and heart health. And my next entry is somehow even more incredible than this case study. I mean, everyone knows that lifting heavy weights may present risks. In fact, if our goal is a better health, we need to focus on light but regular exercising and on the diet, right? But what if I told you that following a common diet, a diet that was all the rage just a couple of years ago, could also send you to the ER with acute kidney failure? Well, this is exactly what happened in 2018 to a previously healthy 24-year-old woman. It's also important to note that this woman gave recently birth to a baby just 18 months prior. But now the 24-year-old woman is in the emergency room with severe nausea, low back pain, and a general feeling of discomfort. She also had a very high heart rate at 103 beats per minute. She looked like she was out of breath, even while just sitting. In fact, her breathing was extremely fast. This is one of the first things the ER doctors noticed. Tachypnea, rapid breathing, could be a serious symptom, especially when accompanied to other symptoms of kidney failure such as nausea and low back pain. This could be a sign of ketoacidosis, a potentially life-threatening condition. After confirming the presence of serious kidney damage and the presence of ketoacidosis in the young man, the doctors were stumped. Ketoacidosis usually happens in diabetics and in CKD patients in the more advanced stages, not to previously healthy 24-year-old woman. How is this even possible? Well guys, if we look at the name of the pathology that is destroying the kidneys of this woman, ketoacidosis, what diet comes to mind if I say ketoacidosis? Yeah, the keto diet. The only diet that could send a postpartum mother to the hospital is the keto diet, obviously. You see, there have been several reports of ketoacidosis occurring in nursing women on keto diets. When a woman is nursing, her body uses extra energy to produce milk. This means she needs more fuel, so her body might burn more fat, producing more ketones. If she's not eating enough carbs and her body is already in state of burning fats from the keto diet, this can push her into ketoacidosis, which is, simply put, a condition in which there are too many ketones going around, causing too much acidity in the body for the kidneys to remove. So, how it ended for the 24-year-old mother? Well, after the diagnosis, she was given insulin and also glucose to help her body switch back to using glucose for energy instead of fat. She was also put back on a diet that included carbohydrates. And even if she didn't recover all of her previous kidney function, her condition improved quickly once she started eating carbohydrates again. So the bottom line here is to avoid following a keto or any other crazy fad diet such as the carnivore diet, and not just if you gave birth recently. The same advice applies to diabetes patients and CKD patients as well, by the way. Up next, what hidden danger could be even more unexpected than a diet that is supposed to actually help? Well, let's talk about one single plant-based food that in 2019 caused a 71-year-old man not just to suffer an acute kidney injury but also to suffer from a permanent loss of kidney function. No, I'm not talking about some crazy dangerous food such as fugu fish or aki fruit, and not even about some high-calories junk food. This is something that most of us eat regularly and that basically everyone keeps in their pantry. The food that sent this man into end-stage kidney failure is peanut butter. Well, and a bit of coffee as well. But the coffee was just to gulp down the huge amount of peanut butter this man was eating. Yes, this story is crazy and it comes with very important lesson to learn. So in 2019, this 71-year-old man presented to the emergency room with severe shortness of breath and weakness. He was so weak, he had to be transported on a wheelchair as he was gasping for air. They later found out that his creatinine was extremely high, meaning that he was suffering from acute kidney injury. He had to be started on emergency dialysis immediately. But how is this possible if only 2 months prior, at his last checkup, the kidneys of this man were in perfect conditions? Well, this is actually very interesting. You see, when this kind of damage happens due to some high oxalate food such as peanut butter, the reason is usually something called oxalate nephropathy, which is the formation of calcium oxalate crystals inside the kidneys, similar to what may cause kidney stones. Okay, now you may ask, what's so special about getting oxalate formations inside the kidneys after eating too much peanut butter? Doesn't everyone get it? Well, no, not at all. Most people can eat all the peanut butter they want without getting oxalate formations. Only 2 categories of people are at risk for kidney stones and oxalate formations. Those with a genetic predisposition, this is called primary hyperoxaluria, and those who had gastrointestinal surgeries or suffer from malabsorption disorders. This is called secondary hyperoxaluria. These are the people that usually get recurring kidney stones and that should be careful with high oxalate foods. And while it's true that also hydration status and calcium intake play a role in the risk for oxalate formation, the 71-year-old man didn't have any of these risk factors. He was eating plenty of calcium and he was drinking lots of water as well. So how is it even possible that this man ended up in the emergency room? Well, the answer shocked everyone in the medical team. You see, this 71-year-old man suffered from a rare genetic mutation involving cryopyrin protein which causes autoinflammatory problems. This condition, and I quote, initiated a larger inflammatory response leading to greater renal injury when given an oxalate-rich diet. This was only observed in mice before, never in humans. So yeah, This is how a man with no previous history of kidney stones nor any risk factor for oxalate formation ended up in emergency room due to a super rare genetic mutation. So guys, what this actually means is that you should not be afraid of eating high oxalate foods unless you have been diagnosed with kidney stones in the past. You see, a patient ending up with kidney damage due to secondary oxalate nephropathy without the usual risk factors is so rare, they got an article published about him. It's also true that having kidney disease in the advanced stages and a fluid restriction is considered a risk factor. So, well, you could get informed more about oxalate if you want. And I recently made a video about this. It's up here and also down in the description. Okay guys, let's take a look at our number one now. This is all about a single vitamin. This is also the story of a 54-year-old man that in 2018, after a trip to South Asia with plenty of sunbathing, as the medical article points out, returned to Canada where he was hospitalized with almost no residual kidney function. And this was peculiar because despite having hypertension and dyslipidemia, the man never had kidney problems before. So the doctors were now trying to make sense of why a 54-year-old man with no previous history of kidney problems was now in need of renal replacement therapy. They started to ask him questions. Was the man doing anything other than sunbathing during his vacation? Maybe something he ate or a substance he took? Nothing made sense until the man started to talk about his supplementation regimen. A couple of years prior, he was recommended by an expert to take a pretty large amount of one vitamin. And since the man felt that this vitamin therapy was working, he decided to take even more. Now, his sunbathing vacation completed the picture of a serious vitamin toxicity that caused serious calcification in his kidneys. And I bet some of you guys know which vitamin is connected to sun exposure and can cause calcification when taken in too large doses. Yes, it's vitamin D. So the doctors knew at this point what was causing the problem, and they told the 54-year-old man to immediately stop taking vitamin D and calcium as well. And you know what happened to his serum vitamin D level? It kept increasing for 4 weeks, even without supplements. This is why you don't take risks with vitamin D. This is a fat-soluble vitamin, alright? The body will store it in your fat cells and it will keep releasing it for months even when you are not taking any vitamin. But how did it end for the 54-year-old sunbathing man? Was suspending the supplements enough to save his kidneys? Well, unfortunately, the consequence of vitamin D toxicity is a buildup of calcium in your blood called hypercalcemia, which is very bad for the kidneys. Calcium can deposit in soft tissues, leaving little rocks in the tissue. Unlike kidney stones, these deposits or calcifications will never go away. He was able to gain part of his kidney function back, however, and he was also able to avoid ending up in dialysis for life. Eventually, he was in stage 3B of kidney disease. Now guys, there is a reason why I say that the vitamin D is the most critical vitamin for the kidneys. While taking too much of it can cause severe damage, we must also understand that not supplementing this vitamin at all may be as dangerous. This is why I recently made a video to show you exactly how to take vitamin D safely. It's up here and also down in the description. And this is all for today. Thank you for watching. God bless you all. Bye!